Hello everybody and welcome back to my channel. I want to take this moment to thank all my subscribers for tuning in and also all the new subscribers. Thank you so much. I see we're growing, we're constantly growing. I look at that number and I'm like, we are actually growing, and it's just so amazing. It pumps me up. It really does. Today we are going to talk about how you as a student nurse can ace through your clinical placement. I'm going to give you 5 techniques that will help you to do super good in your clinical placement. Without further ado, let's get into the first tip. The first tip I would say is to be organized. I know it's cliche, but be organized. Before your placement, like contact your unit, get all your learning outcomes, get everything organized, contact whoever is looking after students in your area. It's going to make you come across really committed to learning. You want to learn, so be organized. The second thing I would say is have really good communication. So if you when you're in clinical placement, make sure that you are interacting with the patients, getting to know how they're feeling, how they are that day, get to know a little bit about their background. And patients always want to talk, they always want to chat because they're lonely, they're not in their home, so anyone to talk to them, they'll be super glad. So just have a chat with your patients, get to know them. Also, I would say have really good communication skills with the MDT as well, so the physiotherapist. Get to talk to them, and you'll find out why one patient needs respiratory physio whereas another patient needs mobility physio, or a combination of both. So when you are communicating with other MDTs, you really are learning a lot, and your preceptor will love to see that. So get your communication skills up to scratch. The third thing that I would say that will really make you stand out on clinical placement is when you are taking initiative. I think this is the most important thing. So what is taking initiative? It can be a little bit vague because as a student you have a scope of practice that you have to maintain, and there's things that you can't do. So I'll give you an example. Say for example, your preceptor says, listen, I have 5 bloods for you to take, this patient, that patient. Do you mind doing that? So you go ahead and then you take blood sugars, and John's blood sugars are 15. Everybody else's blood sugars are fine, but they're 15, and well, you're kind of half not really bothered. You're just yeah, you write them on a piece of paper. An hour later, you go to your nurse and you go, there's my blood sugars that you asked me to take. That is the opposite of an initiative. Taking initiative in that sense would be literally going to your preceptor and being I went to take the blood sugars, and John's blood sugars were pretty high. They were 15. And from what I learned in college, that's pretty high. I remember hearing in handover that he's on insulin. I'm just wondering, is that something that we need to give now? We need to call the doctor. Also, I've documented the rest of the blood sugars that I took and they were all fine, but I do need you to co-sign them. That is taking initiative. That way, I know you are a safe student. Nothing bad is gonna happen on my watch. And if something bad does happen, you're gonna come to me as your preceptor. So that is what taking initiative is like. So we've talked about being organized, we talked about having good communication skills, and we've talked about taking initiative. The fourth thing that you need on clinical placement as a student to make sure you breeze through it, you need to have confidence. You need to be able to literally not be too shy. And it's so difficult because I actually remember one time when I was a first year student nurse, a doctor asked me, oh, are you looking after this room? I think she was a new doctor. Are you looking after this room? And I was like, oh, no, I'm just a student nurse. I'm just a student nurse. And she literally paused for a minute and she was like, you're not just a student nurse. You're a student nurse. You're learning. Come with me, I'm gonna take bloods. Do you wanna see? And I was like, yeah, that'd be good, thanks. So being confident, like you can be shy, but like be confident enough to like observe things, you know, or ask. So when I kind of like was prompted by that doctor to like watch basically venipuncture, then the next time I heard somebody was gonna do a cannulation, I actually was interested, and I asked my preceptor, can I go watch that cannulation? Just it looks quite interesting, and I'd previously seen the venipuncture, but now I want to see the cannulation and just kind of see how like the difference between the two of them. So like that is, you know, being confident enough to ask that, being confident enough if there's a patient who needs to go down for like a scope, ask in advance. If you hear in handover and they're like, oh, this patient is gonna go for a scope, but we need to prep them, literally like take that opportunity, grasp that opportunity. You might have a really good preceptor who will like want you to go and will plan it all out, but you're not always gonna have a good preceptor, and that's why you like need to have that level of confidence to ask and have the level of confidence to answer the phone. I feel like students are afraid of the phone. I don't know why. I feel like answering the phone honestly is gonna boost your confidence because it's just answering a phone, okay? Unless there is a strict protocol on your unit or your hospital where they say students should not answer phone calls. I don't know why they would even do that like that, but you should like literally take the like be confident enough to answer the phone. You 90% of the time you might not have the answer to it, but you're gonna find somebody who does. There's nothing worse than a ward or unit that has the phone ringing all the time and it's like buzzing, and no one picks it up. And you see students like literally running away the minute the phone rings. Don't run away, just pick it up and, you know, use ISBAR, communicate. Just pick it up and answer it. We talked about being organized. We talked about taking initiative, having good communication, being confident. The fifth thing, which is like probably should have been like one of the top ones, but like this is in no chronological order anyways. But the fifth thing is being punctual. Literally, I know things happen and sometimes we're running late, but don't make it a habit. Be punctual. Be there like 5 minutes before time. Like it looks good. It looks like you're present. You want to learn. Please like teach me. I'm a sponge. I want to just absorb everything. That's gonna really help because they always say people will respect you the way you respect yourself, right? So if you are showing up, being punctual, communicating, literally taking initiative as much as you can, and being on time and like being confident, you're gonna get the same vibe back. You should get the same vibe back. Even if you don't get it from one person or two, like your preceptor will see that you are eager and you're like willing to learn, and that is really gonna stand by you. Like just the point about taking initiative is so essential because it'll actually help you through when you become a staff nurse, because as a staff nurse you actually need to take initiative, because somehow when you take initiative it actually you get things done quicker. And it's not because you're running faster, essentially because you are planning ahead. So you're literally like planning what you need to do in the next hour. Like you are taking initiative. You're basically getting things done before they get worse. You won't have to have something get really bad and then it takes up all your time, because you've like basically prevented it from happening because you're thinking ahead and you're taking your initiative. So I hope this video is going to help you as a student nurse on clinical placement. And if there's any other things that, you know, have helped you, like put it in the comment section below. Yeah, so until next time, stay safe, stay blessed. Bye.